If you're focused on this one thing in your practice, you are not going to succeed. Stick around, I'll tell you exactly what it is and what you should focus on instead. But before I do, I'm Tristan Bond, I'm CEO of Practice Acceleration. What we do is we help great healthcare professionals create thriving businesses with an emphasis on building a business that doesn't depend on them. 99% of the people that get on the phone to us and need our help tell me, Tristan, I need more leads. But the reality is that if they just fixed all the leaking buckets in their practice, they'd get to their profit and revenue goal without having to chase down new patients continually. In fact, here's the thing, things actually get worse if you haven't addressed the holes in your practice before adding more new leads in. If you don't have systems for retaining the patients you've already got, they're going to disappear, wasting the money that you've put out there and spent on marketing to get them in the first place. It's counterintuitive. If you can't say with certainty that you retain at least 85% of your leads and patients, you must start improving your systems. Now, when it comes to retention, we find that most practices fall into one of three categories. Which one are you in? Now, if your practice is in the top category, you're very clear on the exact clinical pathway for every condition that you already treat. And you know the exact number of treatments that you must hit to ethically treat those patients to meet the highest of clinical standards. What's more, you'll have a documented system that everyone in your team follows to ensure they hit that goal. And you also track and measure that number every single week so that you know that your team are hitting their goals and keeping their books full. That's category number one. Category two is this. You've got a very clear goal, you're tracking your numbers for retention, you're giving your team regular feedback, but some team members, they're not hitting those goals, and that's costing you money and it's affecting your patient outcomes. Category three is the most common one. You've got a vague goal you want your team to hit, but you haven't clearly defined it. You have no idea if you're even coming close to it because you haven't defined it clear enough, because you're not even tracking and measuring those numbers to compare to your goal level. Worse still, your team don't have a documented system to follow to ensure they give the best clinical outcomes and retain patients throughout their entire treatment program. Now, take a minute to ask yourself, which category are you in? And be honest. So now you've probably got a really good idea of which category you're actually in. Now what you need to do is this. You need to get clear on your numbers and start to track these three things. Number one, how many appointments are you and your team actually recommending? Number two, are those recommended appointments actually getting booked in? And number three, are your patients actually fulfilling that treatment schedule, or are they self-discharging early? Once you start measuring these numbers, you're going to get a very clear view of what's actually going on, what's actually happening in your practice, and what's more, you'll learn to understand which of those holes you've got to plug so you can start to run your practice more profitably and to achieve the success that you do deserve. Now, if you want to take this a little bit further, what I've done is I've put together a patient retention tracker so that you can figure out exactly what category you fit into. Now, I'm going to drop a link for that into the video description below so you can simply download it. Implementing this tracker will be a total game changer for you. So the link for that is just below. Go get the tracker. So thank you so much for watching. I'll see you on the other side.